welcome back to the Educated Associate YouTube channel, where we continue to discuss anything and everything related to associate dentists. Today I wanted to dive into a very important topic, making a good impression. Now, I'm not going to talk about what you're thinking of and making a great impression when you're meeting your patients. While that's vitally important as well, today I wanted to go over obtaining an excellent alginate impression. Over my years in clinical practice, I've developed 5 major tips that I always teach to my assistants so that they can obtain impressions that are accurate and don't facilitate major gag reflexes on both pediatric and adult patients. There's a lot to discuss, so let's dive right in. In order to facilitate an excellent impression, first have the correct tray. In order to select the proper tray, I teach my assistants to check inside the patient's mouth, get a rough estimation for the size, the volume, all the different features going on. Then grab a tray or two of different sizes. Before they spray adhesive on the tray, they should be trying the trays in the mouth. What I always coach them on is that the tray should have enough forward and back distance to cover the back tooth and the front tooth with some space for the material. In an ideal world, on the upper jaw, it won't progress far enough back where the material will go on to the soft palate area. Progression of the soft palate almost always induces a gag. Some people have very tall alveolar ridges and therefore require much more space within the tray to facilitate an accurate impression. Conversely, some people have very short ridges and require much less material within the tray to record the anatomic structures. In patients with tall ridges, you sometimes have to adapt the stock tray with red rope wax along the flange to make it taller. The added height will allow the material to get into the sulcus where we need it, as well as prevent the material from squirting down the back into their throat in unadapted tray. Now, in patients with a short ridge, there's another workaround. You can either use scissors or the high-speed handpiece to cut the flange shorter. I then coach the assistants to use red rope wax to lace the tray so that it doesn't feel sharp to our patients. It's all about comfortability on these things. If you select the proper tray, you can then spray some adhesive on it and go ahead and move on to the next step of the treatment. In order to get a great impression, you gotta have the patient in the right position. No one likes having goo going down the back of their mouth, so in my world, I sit all my patients upright. I sit them upright enough that once the tray is installed in their mouth, they could really lean forward if they had to. That allows gravity to pull the material out of their throat, and in that initial 10 to 30 seconds while the alginate gets hard, we can ensure that no material is collecting near the uvula. This is a great way to help facilitate a gag-free impression. Now, those 2 tips seem very straightforward, and you were probably taught those in dental school. My next 3 tips are very specific to gaggers and things that can be done to help mitigate the risk of causing a gag. Tip number 3 is all about distraction techniques. Now, I tend to use these on all patients regardless of a gag or not, just so that it's less painful for them. One thing I'd like to say after the tray has been installed is breathe through your nose and wiggle your toes. That little rhyme gets their head thinking not about the material in their mouth, but about breathing and wiggling their toes. If you get them to do both of those things, that distraction technique can be excellent in the first 10 to 20 seconds of the alginate setting up, why there's most likely to be causing a gag. Additionally, I just talk about anything I know the patient likes or wants to hear about because, again, I'm just trying to distract them. My 4th tip is a little tip that if the patient tells you, I always gag during these, this is something I'll do before the impression. You can take a little salt water or a little salt spray and spray it in the back of their throat near their uvula. This tends to give you about 30 to 45 seconds of a gag-free patient. So that's a great time to get the tray installed and let it start to set up while they're gag-free. The next tip, I found this in a study from Bangladesh that came out in 2008. How this works is you'd have the patients, if you know they have a gag, you have them kind of squeeze on their left hand in this area right here, in this concave area. It's known as your hagoo point, and it's a good way that if you apply pressure there, it can distract your brain, make you think about your hand. So on patients with a gag, I'll tell them, go ahead and squeeze this hard as I go ahead and install the tray. If they squeeze that for the first 30 seconds of the treatment, you can really help help get them through the procedure without a gag. Now, let me know if you have any tips to help your patients get through alginate impressions, or things that you do differently to get your patients through challenging times like impressions. If you found this information useful, please give me a follow here on my YouTube channel. And as always, stay drilling, my friends.